I'd like to turn things over now to Thunderbird's researcher, Sasha Bragg, who spends much of her time meeting with communities that are participating in our surveys, specifically the First Nations Opioid and Methamphetamine Survey. Sasha is going to join us in a second.
Kwinganawa Lomwa, ni Disinji Sasha Bragg. So it's good to see everyone today. I'm from Munsee Delaware Nation, which is just up the river from where we're streaming today. So as a Thunderbird researcher, I do spend my time gathering information to support what we know about opioids and methamphetamine use in First Nations communities. So we're going to talk a bit about the survey now. So we know that there is limited information on the prevalence, severity, source of supply, reasons for use, and social impacts of opioids and methamphetamines among First Nations communities across Canada. So obtaining better data on substance use has been identified as a priority by various key Indigenous organizations, such as the First Nations Inuit Health Branch and the Assembly of First Nations. So additionally, Thunderbird Partnership Foundation has also identified the importance of increasing knowledge about opioids and methamphetamine use in First Nations communities. So to address this issue, Thunderbird Partnership Foundation helped create the First Nations Opioid and Methamphetamine Survey. So the survey is designed to help inform how to better understand and address opioid use within First Nations communities. So this was done in a collaborative approach with regional representatives and is based on the use of culturally competent knowledge. So the data collected from the survey can be used to address gaps in knowledge related to the complexity of substance use, as well as the impact on individuals, families, and communities. So it is important to note that while this survey is used to assess the impacts of opioid and methamphetamine use in First Nations communities, it is also used to better understand the protective factors surrounding how low prevalence rates of substance use within communities. So to better understand substance issues within First Nations communities, consistent data needs to be available. So for this reason, Thunderbird Partnership Foundation is participating in a national research project, which aims to implement the adult and youth version of the survey in First Nations communities to better understand the impacts of opioids and methamphetamines, as well as the impact of COVID-19 pandemic on substance use and the availability of supports. So this project is funded by the Public Health Agency of Canada. It is a 3-year project that wraps up in March of 2022. So the survey will continue to be implemented after the project ends, as it is a Thunderbird tool. Okay, so the First Nations Opioid and Methamphetamine Survey has 2 modules. So there's a youth module that can be completed by individuals between the ages of 12 and 17, and the adult module for those that are 18 plus. The survey is also available in both English and French. Thunderbird Partnership Foundation is available to support communities in facilitating the survey in any way necessary. So the amount and duration of support is dependent on what communities request. So Thunderbird also follows the principles of OCAP. All information gathered from the survey is owned by the community and will be returned in the form of a community report. The completed surveys will also be returned to the community. So Thunderbird Partnership Foundation will also include this data in a national aggregate report if consent is provided, which you can see is located at the bottom of the survey. If yes is not checked, then we would not use this data in the national aggregate report. So the surveys are community-based. This means that we want all community members to fill out the survey regardless of their knowledge about opioids and methamphetamines. So our aim for this project is to provide communities with a better understanding of the use, prevalence, and impacts of opioids and methamphetamine within the community. The survey will identify participants' knowledge on the availability of harm reduction strategies and their perceptions on these strategies, as well as treatment options, equity challenges, accessibility, and availability of programs and supports. The survey will support the identification of community strengths and the protective and risk factors of opioid and methamphetamine use. So the survey supports the promotion of community capacity. So this is done by collaborating on all stages of the project, including survey implementation, data analysis, and developing the community-specific report. And finally, the data and community-specific report can support and inform the need to develop or improve programs or policies, treatment options, and advocate for change. So the survey can be implemented using hard copies. We also have tablets available that have surveys already loaded onto them. But the latest and greatest way to access the survey is through our new wellness app. So what are you waiting for? Go check out Thunderbird's new wellness app, and while you're there, have a look at our surveys. Thank you.